As the human body enters the twilight years, silent changes begin to emerge, subtle yet meaningful signals that are often easily overlooked, even by the individuals themselves. One unexpected but extremely important manifestation is itching in certain areas. Many people assume it's just a natural part of aging or ordinary dry skin. However, behind that irritating sensation, there may be serious warnings of underlying diseases, including cancer. Itching is not simply a fleeting discomfort. According to medical specialists, when itching occurs in specific areas of the elderly body and persists without a clear cause, it may be an early symptom of internal disorders and even the first sign of cancers, such as liver cancer, pancreatic cancer, lymphoma, and other malignancies. One commonly overlooked area is the palms of the hands. When elderly individuals experience severe, unexplained itching in their palms, especially at night or early in the morning, it may signal disorders in the liver or bile ducts. The liver plays a major role in detoxifying the body, and when its function deteriorates, the accumulation of bile salts in the blood can stimulate nerve endings under the skin, causing itchiness. If this symptom is accompanied by jaundice, fatigue, and loss of appetite, the risk of liver cancer or other malignant liver and bile diseases becomes significant. Another important area to watch is the chest, particularly around the nipple. Persistent itching here, especially if accompanied by changes like skin thickening, peeling, cracking, or unusual discharge, could be an early sign of a rare form of breast cancer known as Paget's disease of the breast. This condition is often mistaken for simple dermatitis or allergic reactions in its early stages. However, if an elderly person notices persistent chest itching that does not improve with moisturizers or antihistamines, they should seek specialized medical evaluation promptly to detect potential cancer early. The skin on the back is another area that deserves attention. Chronic, unexplained itching on the back, particularly between the shoulder blades or along the spine, may be linked to internal tumors compressing nerves or causing metabolic disruptions. In many cases, persistent back itch without clear cause has been recorded as an early warning sign of lung cancer, liver cancer, or pancreatic cancer. These cancers typically develop silently and are often only diagnosed at a late stage, making early detection through subtle symptoms like unexplained back itching crucial for survival. In addition, the scalp should not be overlooked. Elderly individuals who experience severe scalp itching, along with unusual hair loss or flaking, should be cautious. Some forms of skin cancer, such as basal cell carcinoma or squamous cell carcinoma, can begin with minor changes on the scalp. Since the scalp is often exposed directly to sunlight, without proper protection over the years, this can lead to cellular damage and the formation of skin cancers. Many cases of skin cancer are discovered late, simply because patients mistook early symptoms for common scalp conditions like seborrheic dermatitis. The lower abdomen, particularly the pelvic area, is also noteworthy when persistent, unexplained itching occurs. Malignant diseases related to the urinary system, such as bladder cancer, prostate cancer in men, or ovarian cancer in women, may initially present with itching and discomfort in the lower abdomen. If this itching is accompanied by symptoms like difficult urination, blood in the urine, or persistent lower abdominal pain, prompt specialist evaluation is critical. It is important to note that not all cases of itching are linked to cancer. Aging skin naturally becomes thinner, and sebaceous glands reduce their activity, leading to dryness and itching. However, a key difference between normal aging-related itch and serious pathological itch lies in its persistence, its lack of response to standard treatments, and its association with other symptoms, such as weight loss, prolonged fatigue, unexplained fever, lymph node swelling, or changes in skin color. Such small signs are the body's silent language, ways it signals that something might be wrong. Being sensitive to the body's messages, recognizing abnormalities, and responding promptly can make the difference between early detection and late-stage discovery of a life-threatening illness. Biologically, cancers cause itching through various mechanisms. Some cancers, like liver and pancreatic cancer, increase bilirubin levels in the blood, which stimulates nerve receptors in the skin. Other tumors produce cytokines and histamines, substances that trigger inflammatory responses, leading to generalized or localized itching. Growing internal tumors can also compress sensory nerves, causing itching, numbness, or pain. The crucial point is that elderly individuals must move beyond complacency and self-diagnosis. Instead of guessing the cause of their itching and self-medicating with creams or pills, they should undergo proper medical consultations with specialized tests, such as blood tests, ultrasound, CT scans, or skin biopsies to accurately identify the cause and receive appropriate treatment. Proactive skincare is also essential in both preventing and detecting early warning signs. Using gentle body washes, maintaining proper skin hydration, avoiding excessively hot showers, limiting direct sun exposure, and following a diet rich in skin-essential vitamins and minerals, such as vitamin C and E, zinc, and omega-3 fatty acids, are simple yet effective steps to protect the skin and support overall health. Mental health significantly influences how symptoms are perceived. Chronic stress, anxiety, or depression can intensify sensations of itchiness or exacerbate underlying diseases. Thus, maintaining a positive mindset, engaging in light physical activities like walking, practicing tai chi, yoga, or meditation, and keeping a consistent routine with adequate sleep are powerful ways to strengthen natural immunity and reduce the risk of serious illnesses. The living environment should also be considered. A clean, well-ventilated, mold-free home helps reduce the risk of skin infections and allergies. Using bedding made from natural materials, washing linens regularly, and avoiding harmful household chemicals can have a profound impact on skin health in older adults. It is undeniable that as we age, the body requires more attention, listening, and care. Small signs like itching in certain areas should never be dismissed. They may represent golden opportunities for early diagnosis and treatment of dangerous diseases, helping elderly individuals maintain a healthy, independent, and fulfilling life. Ultimately, everyone should remember that having the right knowledge about health, being proactive in prevention, and scheduling regular checkups are the keys to unlocking a peaceful, healthy, and meaningful old age. Never ignore the small signals from your body, for sometimes it is those seemingly harmless signs that carry the most powerful reminders of the preciousness of life. One of the most common mistakes is the self-prescription of topical medications without consulting a doctor. This habit not only fails to improve the condition, but can also mask important symptoms, making the diagnosis much more difficult. The second mistake is assuming that changes in weather or dry skin are the only causes of itching. While it is true that seasonal changes, especially during dry winter months, can cause skin dryness and itching, if the itching persists for several weeks and does not improve despite proper moisturizing, deeper underlying causes must be considered. Another mistake is neglecting to pay attention to accompanying signs such as rashes, changes in skin color, the appearance of nodules, thickened patches of skin, or any other abnormal changes. These can be clear warning signs of skin cancer or serious internal diseases. To prevent severe consequences, seniors should take the initiative to undergo regular cancer screenings, even when no obvious symptoms are present. Comprehensive checkups, specialized blood tests, abdominal ultrasounds, endoscopies, or dermatological examinations can help detect potential abnormalities early. The skin is the body's largest organ and serves as a mirror reflecting internal health. An experienced dermatologist can often detect early warning signs of many serious diseases simply by observing the skin. Not only skin cancer, but also conditions related to the liver, kidneys, thyroid gland, and immune system. Regular dermatological examinations also help detect abnormal moles, precancerous skin lesions, or signs of melanoma, a malignant type of skin cancer with a poor prognosis if not diagnosed in time. In addition to monitoring itching symptoms and undergoing regular screenings, seniors should also adopt positive lifestyle changes to reduce their risk of disease. Staying well hydrated each day helps maintain the skin's natural moisture and supports the body's detoxification process. A diet rich in leafy greens, fresh fruits, nuts, and fatty fish provides essential vitamins, minerals, and omega-3 fatty acids that enhance skin health and strengthen the immune system. Limiting alcohol and tobacco use, Two major risk factors for liver damage and cancer can significantly lower health risks. Practicing stress reduction techniques, such as meditation, yoga, or simply taking time to relax, read, or walk in nature can also help minimize the negative effects of stress on overall health. Protecting the skin from UV rays by wearing wide-brimmed hats, long-sleeve clothing, and applying sunscreen when outdoors is an effective way to prevent skin cancer. An early medical checkup can change your entire future. Timely vigilance can open the door to many more years of healthy, fulfilling life with your family and loved ones. Cherish your body and listen closely to every signal, no matter how small, for it is often through these seemingly minor signs that life sends you the most profound messages about your health and happiness.